Peripheral neuropathy, spinal, diabetic, or vascular. Which one do you have? Peripheral neuropathy doesn't just cause pain, it steals your life. If you can't take the numbness or the relentless stabbing and burning sensation, then join Dr. Tom Roselle at the Roselle Center for Healing for a free health class on peripheral neuropathy on Wednesday, May 20th at 6 p.m. Stop managing misery and finally learn how to live without pain. Reserve your seat today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle. We're here with another great episode right on WMAL 105.9 FM in the greater Washington area. So let's get to the program. I got so much to tell you and so little time to do it in, but maybe we can figure out a way to make that difference. Actually, coming up on May the 20th at 6 p.m., at the Roselle Center in Fairfax, we're going to be hosting an evening on peripheral neuropathy, whether it's spinal neuropathy, stenosis that causes your feet to go numb, or diabetic patterns or vascular patterns. You just can't feel your feet anymore. You're kind of stair-stepping around. This is an opportunity. Join us May the 20th, a Wednesday evening, 6 p.m. No excuses anymore. It's bright and sunshine out there, and you'll go home in the same type of thing. So you can register for that class by going to rosellecare.com. That's ROSELLECARE.com. You can do it online, that way, or you can do the old-fashioned way. Call us at 703-698-7117, and I look forward to meeting all of you. And we'll talk about some things that you can do immediately and take action steps to get your feet back, if you will, or get that numbness out of your legs, get that paddleboard gait that you have to work better. But let's get into today's program. We're going to talk a little bit about one faction of that. We're going to talk about diabetic neuropathic problems. And many of us, think, well, I'm not diabetic. But here's the thing that I want you to know about, that you can be in the stages of diabetes in different tissues of the body. It doesn't have to be an overall situation for you to start losing sensory and motorical function anywhere in your body, but we're talking about your legs and your feet and your low back and so forth. Now, remember that when we're talking about a neuropathic problem, it can affect anything, anywhere in your body, because you can't function, if you will, without the nerves. So it can affect your heart, it can affect your liver, it can affect your kidneys, it can affect your feet and your legs, it can affect your brain, it can affect your eyes. So knowing all of that, wouldn't you like to know where the problem begins and what perhaps, you can actually do something about it? So here's what I want you to get, right? If we ask the question, do you have to have full-blown diabetes to have diabetic neuropathy? Well, if you go to the Mayo Clinic AI site, they're going to tell you, no, you don't, not necessary. Diabetic neuropathy can occur in people with diabetes, regardless of the severity of the condition, or it can occur in people who are suddenly beginning different tissues to begin to be insulin resistance or too much sugar accumulating in that area. Some of those things that we've mentioned called glycophates, which we'll get into a little bit, but that complication can develop from high blood sugar levels, and it can get into the different tissue. It's not limited to type 1 or type 2 diabetic patterns. And remember, we affectionately call type 3 diabetes, right? Type 3 diabetes, that's when you lose your mind. That's Alzheimer's. That's the mental deterioration. So we're starting to see a lot of things. That also is a neuropathic problem, neuropathy that is due to other factors. And we can look at high blood sugar levels. Sure, absolutely. And you're seeing that blood sugar at 110, 115, but your A1C is only at 5.9. Well, it's not over, whatever your doctor says, you're fine, we'll just watch it. Well, that's a flag. It's telling you that it may be higher in other places, but guess what? They don't know how to test for it, but there's a way of identifying it in functional medicine, which we're going to talk about on the 20th, and how you get that done and what you really need to know. So therefore, straight up, it's not necessary to have full-blown diabetes to experience diabetic neuropathic deterioration and problems. So put that away and think about it for a while, because we can talk about, can diabetics develop neuropathy? Absolutely, we know that. We know there are treatment options medically, but they really don't work very well. How to diagnose neuropathic problems, that I'm going to get into very deeply on the 20th with you, and what it really means. There's some liver enzymes that have to be done in any case that you suspect neuropathy, but particularly when it may be due to blood sugar transport problems. And the one I'm going to tell you about right now is called LDH. LDH is a very specific liver enzyme that can cause all kinds of havoc throughout your body, but it's always present as you're beginning to develop neuropathic conditions. It's a test used to detect tissue damage, monitor disease processes, assess the severity of certain conditions, but particularly when it comes to the complications of blood sugar transport, it has to do with heart, liver, kidneys, and muscles, and red blood cells, and so forth. One of the things that I don't know why, but when patients come into the office and they bring me their blood work to take a look at it, invariably, the labs do not automatically order LDH, which is a liver enzyme. So you want to order it because you want to detect high levels of cell damage within the body, whether it's damage due to injury or disease or cell death. Remember, we're talking about blood sugar transport problems, which is one of the primary reasons that cells in the body deteriorate. LDH is very important in assessing liver function. And the only time they seem to want to run the test, based on our experience, what we see coming into the practice, we run it all the time, by the way. If I'm going to run a liver panel, LDH gets run. But we're looking at things like hepatitis and cirrhosis and things of that nature, because they want to see how much damage. Well, you know what? There's other tissues that are being damaged besides liver function. So we've got to get it straight. If you go in and see your doc, ask them to run LDH if they're going to run liver enzymes. And so it's also used to evaluate certain types of cancers. LDH levels can be used to assess the severity of cancers and monitor, by the way, the effectiveness of the chemotherapy. But again, how many of you have, God forbid, gone through that and your doctor orders some tests, but are they ordering it? You have to check for infections and inflammation, but some infections or inflammatory reactions can bring about significant liver damage, leading to high levels of LDH. So very important, right? But how many docs actually do that? So I'm giving you some things that you need to really understand. Normal adult LDH levels typically range somewhere, if you look at your blood work, 140 to 280. But the ranges vary based on laboratories, and that's one of the crazy things. Go to Cleveland Clinic and they'll give you some into their site. Go clevelandclinic.org and they'll give you the parameters for it. Now, the LDH is a broad diagnostic tool, and it helps detect tissue damage. Now, wouldn't that be great to be able to really look to see if what you're doing is getting better, getting worse, monitoring disease progression? I don't know about you, but I sure want to know that if something's going on with my body. And we also can look at it. So if somebody drinks too much, whatever, you name your alcoholic beverage, And they said, well, I don't drink that much. Well, how much do you drink? Well, I have a drink, maybe two every night, and I maybe skip a night or so. But that LDH will tell you whether or not there is a problem that is bringing about. So you use it as a monitor. It's not just whether it's way at one extreme or way at the other. You look at it as a range. And does it start moving up? If you start seeing any enzyme reaction that starts going in the right direction, even though that it's within the normal parameters, it's telling you you've got an issue. Don't just say, well, let's see what happens. Let's wash it. It's telling you take some action steps now. Let's get it done. Let's do what we have to do, right? So remember, LDH, also called lactate dehydrogenase, measures the amount of LDH in your blood and other fluids actually, and it checks for tissue damage. Remember LDH tissue damage, and it often is very finger pointing at the liver, but it tells you other systems as well that are not working the way they're supposed to be working. So it's critical, it's very important that we do the things the right way and we watch based on monitoring. Wouldn't you like to know if you're getting better? This is one of the lab tests that's really important. Wouldn't you like to know if there's damage that's sitting there that might be getting progressively worse? I don't know about you, but when I run, my blood work about every 9 months to 12 months, 9 months to 12 months, that's me. I'm a crazy boy. I want to see what's going on. I always run LDH levels, and, some of you say, well, do you drink a lot? No, I drink maybe a glass of very red Italian wine, maybe a couple of days a week, and that's about it. But there's other things, there's stress levels. Did you know that if you were always in a state of upset anger, particularly the term is anger, you want to always bite somebody's head off. Guess what happens? You provoke liver enzyme energetics. And over a period of time, just anger can cause the liver to break down. So if the liver's not working the way it's supposed to, you have other factors that are not going to be as supportive, if you will, across the board. And we could talk about that for about 3 hours here. Let's get in a little bit about what you can do and watch, right? So while diabetic neuropathic problems, according to the medical literature, only can be supported, in my world, you can change anything as long as you understand what the problem is. The body's incredibly forgiving. You have the biggest target these things have that they break down is the wrapper around the long nerves. They're called the myelin sheath, right? And the most important step in stopping this progression of neuropathic deterioration, destruction, is keeping your blood sugar and your LDH and your A1C hemoglobin at very specific levels. The laboratories say you got to keep your A1C 7% or lower. I'm here to tell you that A1C better be under 6, and your liver enzymes have to be normal, and that A1C, as we just talked about, that A1C and blood sugar and LDH levels got to be on the lower ends all the way through. So what can you do to help yourself if you're beginning to think that I can't feel my feet? I'm stepping around like, as somebody that can't feel the ground anymore. My feet are cramping and tight and so forth. Well, obviously get the extra 35, 40, 50 for some of you around the midsection off. And let's let the body neurologically do what it's supposed to be doing. Get a little exercise. Exercise improves blood sugar metabolism. It helps control that blood sugar transport system. It drops inflammation, but you got to do it every day. Every day, you say it to me. Yeah, every day. And guess what? 15 minutes, that's it. No more than that. And you can do it just by stretching. You can do that by walking a little bit. I tell my patients, look, go out and walk 5 minutes out, 5 minutes back. You just did 10 minutes, so you did 15 minutes. Now, what else can you do? And outside, get your butt outside. And then if you live in a house that has stairs, walk up and down the stairs multiple times a day. And guess what else you can do? You start doing chair yoga, doing Tai Chi walking, things of that nature, little things, but do it every day. You will be surprised just doing that. And obviously watching what you put in your face, the sugars and sodas and coffee, the black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products. Yeah, I know it's a mouthful, right? It's a huge mouthful. But at the end of the day, if you do it the right way, if you really watch what it is that you're putting into your system, your body will forgive you. It begins to reverse things. By the way, there's medications that you have to understand that are not necessarily the best, and a lot of them are the chemotherapeutic drugs and so forth. But a diabetic neuropathy diet, if you will, is supportive of the nerve health, and it slows down further damage. So what does that mean? That means tons of vegetables. That means high levels of protein. That means getting the garbage, meaning the fast-acting carbohydrates and things that turn into sugar quickly, out of your diet. That includes your fruit juices, that orange juice, that apple juice that you have in the morning. Stop it already. Get rid of it. That's high concentration of fructose. Your body doesn't want it. It doesn't need it. You need to have protein in the morning. Give yourself a 12, 13-hour fasting period. So you have your dinner at 6:30, 7 o'clock at night. Don't eat again until 8 o'clock in the morning, 8:30, and then make sure you start your day with protein. End your day with protein, start your day with protein, and you'll be finer, if you will. You like those words? You like finer? You'll be much better off, if you will, than you would otherwise. There's a certain amount of vitamins. Vitamin D and B complex may help sustain and so forth, and something called ALA. There are things there that will help. By the way, any of these things that I tell you about, if you're not patients of ours, you can go into the Roselle Center website. And, I want you to do is I want you to scroll into something called the Ageless Health store. And if you go into the Ageless Health store, you can see all kinds of things that I put up there for you. I created a shopping place for you to go with the vendors that we think the most of. But in this particular, you click that, you go in, and you're going to see like 3 little squares, and one says full script. And full script, if you click it, what they're going to ask you for is an email, and they're going to ask you for a password. And you can make it up any way you want to, right? Whatever you want to. You can just say, strategies, and make the I at the end a 1 and so forth, whatever. Doesn't matter. Something that makes no sense to anybody, but make sure you write it down so you can get into. And you can go in and you can look at different companies directly, or you can look at different products. So I just told you about vitamin B complexes, right? So there's something called Basic B. There's Bio B100, Biotics Laboratories. Check those out and order them. And you can start taking some things. Choline is critically important. Glycine is critically important. And you can order those right online, right there, because we care about you and we want you to be able to have the best products that are available. There's, everybody's still kind of freaked out about viruses all over the place. If you go into rosellecare.com and you look at Air Tamer, it's the middle box. It says it's an effective personal air purifier. During COVID, when I was traveling, and I never stopped, I was all over the country, and I was teaching and around people all the time. I never masked up, but I wore an air tamer, and that air tamer will knock out the majority of all viral patterns within a very, very short period of time. It's amazing how it works. It's proven to eliminate like 99% of everything that's around you within basically just a few minutes. It's incredibly effective. So I don't know about you, but I still travel with one, and I would encourage you to do the same thing. So go to that site and see what you see, and protect yourself. Let's get back into the program a little bit, and don't forget, join us on the 20th. I want to meet you. Diabetic neuropathic problems can be very reversible if you catch it before it fully, completely destroys the neurological tissue. But if you go too long, it will do just that. It will break things down. So if you get your vitamin D in, you got to do it. Antioxidants, your fish oils and things like that. That will make a difference. And get your butt up and start moving around. I don't care if it's with a cane or whatever it is. So what are we talking about? The nerve damage from diabetic neuropathic pain can be stopped and in most cases is not completely destroyed. It can be reversed under the right conditions. We use things like pulsar frequencies, scalar frequencies. We use low energy light lasers. We take the pressure off the nerve root. We stimulate body's reflexes and so forth. And we're going to show you a lot of that, by the way, when you come on the 20th. I'm going to show you a lot of things that we do. But remember, you don't have to be in a full-blown diagnostic, medically diagnostic state of diabetes, if you will, to have diabetic neuropathy, because the individual systems can be affected. And you can get blood sugar transport problems slowly building up over time. It can affect your eyes. It can affect everything about you. So what do we want to do? We want to reverse and change as much as we possibly can reverse and change. It's important. So when you begin to understand that things are not isolated, unfortunately, medical diagnostics, I'm talking about the normal allopathic processing, are not showing the onset. They're showing the long end damage at that point. But you can shift these things by beginning to monitor and watching for the primary shifts in what we talked about. We talked about regular blood sugar levels, glucose. We're talking about A1C hemoglobin. We're talking about LDH. Those are the things. And then if we want to, we could actually run all kinds of levels for vitamin. We can look for things, for example, like heavy metal problems and so forth. But it's important to see whether or not your blood sugar is being transported properly. And there's an initiator. You know, you've heard me talk about the adrenal glands. That's your fight flight. That's your ability to get up and fight the tiger, go punch somebody. You know, and unfortunately, some of us get stuck in that. You know, we're always in that fight flight situation. We always want to take on the world and go to battle. And so we never put ourselves in a parasympathetic platform. Parasympathetic means that you kind of go down the crazy a bit and get your body in a place where it can begin to really resolve, reverse, and heal itself. So if we know we can do that, if we know that we can reverse and turn things around, why wouldn't you want to? Why wouldn't you want to reverse and change things? I don't know about you, but I sure want to. I want to make things different. I want to reverse things as best I possibly can. So join me on the 20th. Join Dr. Jerry Cowart. He'll be my co-presenter. And we're going to get into this intimacy of why you're destroying yourself. And maybe at one point, it's only your eyes. Maybe it is another point, it's, you know, your brain. You can't think like you used to. Maybe your heart's not working the way it's supposed to, and the doc is telling you that muscle is weak. I have so much to tell you and so little time to get it done. But look, the important piece is know that you can stop this diabetic progression. You can shut it off. Body's extraordinarily forgiving. It can begin to reverse itself overnight if you did the right thing, if you put it in the right direction. Look, we're coming up to the end of the program in just a minute or two. And I want you to know that so much more of this is on our website. You can go to drtomroselle.com. Check it out there. You can go to rosellecare.com. You'll find things there. And let us know how we can support you. What kind of information do you want? How can we put you in a place that you take control of your body? Remember my book, Ageless Health? Health is a do-it-yourself program. You need to be the captain of your ship. You need to be the director of what goes on in your body. It's not, yes, sir, yes, ma'am, when you talk to your doctors, take this pill and, well, let's see what happens. We'll watch it. What does let's watch it mean? Until it's too late and you do have advanced deterioration and diabetic destruction? I don't know about you, but I'd like to stop at someplace well before it got to that place, knowing that my body can change and turn things around. It's critical that you take action steps, because all that you do when you take a drug, you can take another drug to stop the side effects of the reactions from that drug. And then pretty soon you're going to take another one to stop the side reactions from that drug and so forth. It's ongoing. Join me on Ageless Health live stream. You go to drtomroselle.com. You can find it right there. We're coming up to the end of the program. I'll be back here again next Sunday at high noon in the Washington area, bringing you another program. Remember, I'm here every week, one reason. I love you all.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com. Peripheral neuropathy, spinal, diabetic, or vascular. Which one do you have? Peripheral neuropathy doesn't just cause pain, it steals your life. If you can't take the numbness or the relentless stabbing and burning sensation, then join Dr. Tom Roselle at the Roselle Center for Healing for a free health class on peripheral neuropathy on Wednesday, May 20th at 6 p.m. Stop managing misery and finally learn how to live without pain. Reserve your seat today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.